Hello everyone. In this presentation, I am going to explain in detail about the reasons for the pain which occurs after finishing root canal treatment. Today, I will be discussing about the pain which occurs immediately after finishing root canal treatment, that is within a week after finishing the therapy. In this presentation, I have covered the 10 causes which can be considered as the most important reasons for the pain which could arise after finishing the root canal treatment. Stay tuned and listen to this presentation. I ensure that at least 1 or 2 points will be new to everyone who listen to this presentation. The first and foremost important factor which I consider as the reason for the pain after finishing root canal treatment is the presence of inflammatory mediators. We all know that pain is caused by inflammatory mediators. These inflammatory mediators will be present in high level whenever there is pulpal inflammation. This inflammatory mediators not only present within the pulp tissue, at the same time it will be present surrounding the tooth in the periapical tissues also. While doing root canal treatment, we will be eliminating all the pulpal tissue and the inflammatory mediators which are present within the root canal system. But what will happen to the inflammatory mediators which is present surrounding the tooth structure? Body has to neutralize it. But for neutralizing it, it will take time. It might take a day or two. You might be wondering that even after finishing the root canal treatment, why the pain have not disappeared immediately and completely? Because the inflammatory mediators are still there. As long as the inflammatory mediators are there, pain will never disappear. So it is wise to wait for 1 or 2 days for the body to take up and neutralize these inflammatory mediators so that the pain will disappear completely. The next reason that I consider as the reason for pain after doing root canal treatment is the apical extrusion of debris. The root canal system is infected. It consists of the dead bacteria, the dentinal debris, the dentinal shavings, the necrotic pulp tissue, and so many other unnecessary structures and substances will be there inside. While doing cleaning and shaping, there are high chances that this debris which is present inside the root canal system through the apical foramen will go to the periapical region. In the periapical region, it will exert inflammatory reactions. Typically, the pain because of apical extrusion of debris will start after a day or two after completing root canal treatment. The third reason which could be considered as the reason for pain is apical extrusion of root canal irrigant solution and also the intracanal medicament if we have placed in case of multiple visit root canal treatment. The chances for extrusion of the root canal irrigant is more whenever there is apical violation or if we are maintaining a apical patency. Ideally, the concepts whether we have to maintain the apical patency or not to maintain the apical patency remains a controversy, but if you are maintaining apical patency, the chances for the irrigant extrusion to the periapical region is more, and especially if you are using an irrigant which is highly caustic like a concentrated solution of sodium hypochlorite, the chances for the pain which occurs after root canal treatment is much more. The next important reason for pain after finishing root canal treatment is the violation of the apical foramen. While doing cleaning and shaping, we have to do the canal enlargement or cleaning and shaping only up to the minor constriction. Minor constriction is a location which occurs approximately 1 millimeter from the radiographic root canal apex. If our working length determination is wrong or without having a proper tactile sensation, if you are working beyond the apex, what would happen is the violation of the apical foramen. The apical foramen gets enlarged and also the file will go and hit the periapical bone and the periapical tissues which are present. This will open up the root canal system to the apical tissues and the chances for the debris extrusion, the irrigant extrusion, and also the root canal obturation material to the periapical region is much more. Along with this is the mechanical injury caused by the endodontic files to the periapical tissues. All of these factors will add up together, resulting in a severe periapical inflammation and extreme pain. The next factor which would be responsible for occurrence of pain is the local adaptation syndrome. Let's see this with a graphical explanation. Let's consider the root canal system is infected. It consists of bacteria which is present within the root canal system. And every day, a certain number of bacteria through the apical foramen will be reaching the periapical region. The body's defense mechanisms, the defense cells like the neutrophils, the monocytes which are present in that region will destroy this bacteria which is entering inside the periapical tissues each and every day. As this is happening on a routine basis, the local tissues get adapted to this infection and the defense mechanism each and every day. So there will be no inflammatory reactions which are happening to a greater extent, and there will be no pain felt by the patient. On the day when we are doing cleaning and shaping, millions of bacteria will escape from the root canal system to the periapical tissues. This bacteria which goes to the periapical tissues will be counteracted by the body's defense mechanism, but it will be too inadequate in a short time to exhibit the defense mechanism and bring the infection into the control. What happens is this bacteria will establish an inflammatory reaction in the periapical tissues and which will lead to severe pain. This can be considered as the most important reason for occurrence of pain in an infected root canal treatment, but otherwise an asymptomatic patient. So whenever there is an asymptomatic tooth, you are doing root canal treatment, and after finishing the treatment, if there is pain, this will be the most probable reason. The next reason for the occurrence of pain in a root canal treated tooth is the pulpal remnants and also the missed canals. Many dentists often consider that if there is pain which occurs after finishing root canal treatment, and if the patient comes back with pain, the first thing that dentist has to do is to suspect for a missed canal or for pulpal remnants. But from my point of view, the chances for the pulpal remnants and the missed canals causing pain in a short term is very less. Missed canals and pulpal remnants causing pain most probably in case of a long term, not in a short term. And also in a vital tooth, if there is a missed canal, the most important symptom which is given by the patient is sensitivity in a root canal treated teeth rather than pain. But still, pulpal remnants and missed canal should be considered as one of the causative factor for occurrence of pain. The chances for missed canals to be present in case of maxillary first molar is too high, where the dentist inadvertently missed the presence of a MB2 canal. One more tooth which is more frequently involved regarding the missed canal is the mandibular incisors. In many cases, there will be two canals. Almost 40% of the tooth will have two canals, but the chances for missing the lingual canal is too high. If we are maintaining a good working length and sticking on to that working length while doing cleaning and shaping, the chances for the pulpal remnants in a clean and shaped root canal system is very less. This is more frequently found when we are not using root canal irrigant while doing cleaning and shaping. One of the common reasons that a patient visits the dental clinic with pain after finishing root canal treatment is the occurrence of periapical abscess after completion of root canal treatment. Let's recall the local adaptation syndrome which we saw a while ago. The root canal system is infected and the bacteria, while doing cleaning and shaping, escape from the root canal system to the periapical region. The body will exhibit a defense mechanism and try to destroy these microorganisms. But during this fight between the microorganisms and the defense cells, there is a chances for pus production. Once there is production of pus, there is no space which is present in the periapical region to get this pus to accumulated. So the pus starts getting accumulated in the periodontal space between the bone and the tooth. This will start pushing the tooth out of the socket, and the patient may come and complain of a slight mobility of the tooth and also the tooth extruded from the socket, so that whenever the patient is biting, this tooth will be the first tooth which comes in contact in occlusion. So the reason for this is the pus which gets accumulated in the periodontal space, which is pushing the tooth out of the socket. The next important cause for pain after root canal treatment is the occurrence of cracks and fractures in a root canal treated tooth. Again, the cracks and fractures are a typical signs of long-term failure of a root canal treated tooth or a structural failure of a root canal treated tooth. But even in case, in short term also the chances for fractures and cracks of the tooth are present. So whenever the patient comes to a dental clinic and gives a complaint that there is pain while only chewing, then this factor also should be taken into consideration. The next reason for pain could be the extrusion of obturation materials like the gutta percha and the root canal sealer beyond apex. Whenever there is apical violation or whenever there is an inaccurate determination of a master cone, the chances for the obturation material like the gutta percha, especially in case of injectable gutta percha systems or the root canal sealers, to go beyond the apex is more. People often consider that the presence of the sealer perf in a radiograph as a typical sign for success after doing a root canal treatment. But the recent literature states that the chances for success gets reduced if there is extrusion of obturation material included the gutta percha or the root canal sealer beyond apex. So I would recommend that whatever the type of the obturation material you are using, whatever the types of gutta percha systems you are using for obturation, whatever the types of the sealer, whether it is a resin based, zinc oxide eugenol based or a calcium silicate sealer, however, I feel it is better to avoid extrusion of the sealer or the obturation material beyond apex. I personally do not consider the extrusion of sealer beyond apex as a sign of successful obturation, but I do consider it as a sign of apical violation or inappropriate use of obturation techniques. Not but the least, one of the common reasons for pain after finishing root canal treatment is the temporary material or the permanent coronal seal material which is placed after finishing the root canal treatment is making a high point while the patient occludes their teeth. We should understand that all temporary restorative materials will expand while setting. While expanding, it can expand and it can protrude out of the access cavity that we prepared. So people might be wondering, is it wise to keep the tooth in infraocclusion? No, I do not recommend keeping the tooth in infraocclusion after finishing root canal treatment. What we can do is, maybe we can keep the temporary coronal seal material after finishing the root canal treatment in a little infraocclusion. But what I do in my day-to-day practice is, after finishing root canal treatment, I place a permanent coronal seal immediately and check the occlusion and maintain a proper occlusion with an articulating paper and leave the patient with a corrected occlusion. Permanent coronal seal material like a composite or a glass ionomer cement will never expand. So the chances for the high points to occur with a permanent coronal seal material is very less or almost nil. So if you are placing a temporary coronal seal material like a zinc oxide eugenol or Cavit G or something like that, then you have to be very careful to keep the restorative material in infraocclusion. Do not chop off the tooth with the entire occlusion to an infraocclusal level, which would hinder the success of our root canal treatment and a long-term prognosis of the root canal treated tooth. Some of you might be wondering, I have mentioned only about the reasons for the pain and not to prevent or treat this pain which would occur after finishing root canal treatment. Yes, in the coming presentation, I will be explaining about how to prevent and treat the pain which occurs after root canal treatment. That is the 10 reasons which I have mentioned. I will be giving explanation how to prevent the occurrence of pain in these 10 cases, and if there is pain or if the patient is coming with pain to the dental clinic, then how to manage the pain after endodontic therapy. Stay tuned for the next presentation. Thank you. Have a great day.